Good morning, everyone.
Good morning.
Good morning.
The names look familiar. I'm Rita Lamb, and help facilitate or set up these meetings. And we are well into this is 7 sessions. So we're going to go a few more weeks before we make it a wrap for this season. And it's been a great several weeks that we've had with the information that's been shared and the speakers that we've met and spoke with. Today is just another example. So Jennifer is actually on. Do you go by Jenny?
Yes, Jenny.
Okay. I just saw your name come up. She will be presenting first, and then I think Michael's going to join us probably around 10:45 and probably kick off his portion at 11, and then we'll go from there. So I'll be on, Jenny, if you have any questions or need anything. And this is recorded so that we can get the information back out to those who couldn't attend or are reviewing any information for their upcoming exam. And well, we've got the chat going as well. So if there's any questions for either speaker, please just probably easiest to use that since there's quite a few people on. There's 15. Usually we get to around 20 or so. And then if there's anything at the end, feel free to ask questions. And then also well after the session, you feel free to email either speaker or myself. So with that, I'll turn over to you, Jenny.
Okay. All right. Let's see if I can share. All right. All right. So I'm Jenny Branham. I'm the Biosafety Officer with the University of Virginia. My office is a part of environmental health and safety. You've probably heard us helping out a lot with some of the things going on at UVA with the COVID pandemic. And I just want to make sure, is everybody seeing the slides move?
Yeah.
Good. I've given
Yes,
presentations
definitely.
halfway through and then they're like, the slides never moved. Well, shoot. So our environmental health and safety's mission is fundamentally just to support research and education and patient care activities and making sure that we promote a safe and healthy environment for not only the researchers, but the patients and any kind of clinical workers who are working with them. We try to successfully achieve high quality programs, training evaluations, and consultation that are specifically designed to minimize safety, health, environmental, and regulatory risk to the university community. So some of our core services is biosafety, which I'm part of that, radiation safety, fire safety, chemical and laboratory safety, general safety, which includes indoor air quality. So some of your stink alerts, like you might smell gas, that type of thing. Ergonomics, making sure you're sitting at your desk properly. Sometimes that's become an issue with us all working somewhat remotely at home. Asbestos, that's a big portion. You probably heard about U-Haul having to be taken down because of the asbestos content. That was our guys doing that. Lead, they also do that. The asbestos guys do the lead content as well. Noise protection, fall protection, especially for facilities who are climbing all over everything, ladders, changing light bulbs. You don't think about it, how high they have to get up on some of those ceilings, especially in the conference rooms and the lecture rooms. Laser safety, we do have some lasers on ground. We have people to help with that. Training and education. We try to make all of our trainings available online to make it easy for researchers and those who need that extra education. We provide consultation, compliance aid. If you're not quite sure if you're being compliant with regulations, we try to help with that. Waste disposal, we have all kinds of waste disposal. We have regulated medical waste, which is our biohazardous waste. We have chemical waste, radioactive waste. So our office does a lot of that. And also we can help with shipping, especially shipping infectious materials. And again, if you wanted to take a further look at some of our core services, you can go to our EHS website and take a look at that. You can find just about anything you want to know. We have a lot of information on that website. Even if you were curious and wasn't sure about what kind of waste goes where, or what kind of training we have available, or how to handle certain biological materials, that type of thing. So there's a lot of regulatory compliance that we have to follow. So OSHA being one of the big ones, not only for bloodborne pathogens, but also for chemical safety and ergonomic safety and those type of, any kind of labor type intensive things, we have to follow OSHA. Environmental Protection Agency, EPA. Feel like I've been on the EPA site nonstop recently with the COVID, making sure that all the disinfectants that we have on grounds that is used in the classrooms and different places is actually EPA approved to kill SARS-CoV-2. Department of Transportation, so DOT, that's with transporting any kind of regulated or hazardous materials. We work with them to make sure we're following that if we have to. So just thinking about transporting regulated medical waste, our group picks that up. So we have to be in compliance with Department of Transportation because we're trucking it, we're putting it on a truck and taking it to a facility. So we have to follow that and make sure those people who are shipping are following DOT regs too. We also are, we work with Virginia Department of Environmental Quality, or DEQ. We have to follow that for any kind of waste disposal. IATA, that is our International Air Transportation Association. That's when we give our shipping training, we follow the most stringent regulations, and IATA gives us the most stringent for international shipping materials, shipping any kind of materials regulations. So we follow that, and that's what we provide in our training. United States Nuclear Regulated Commission, that's what our radiation safety group follows. USDA or APHIS, that's what we follow for any kind of animal research. If we're working with animal materials, we would have to follow, or any kind of animal pathogens, we would have to follow that, like hoof, foot and mouth disease type of thing. We would have to follow that if we were using that on grounds. NFPA, that would be for fire safety. Let's see, what else? It's a lot. And then Virginia Department of Health, we follow that, especially now with COVID. We have to report to them if there's any items. We report to them for if there's any incidents with agents that may be spread, such as some of our select agents. We have to report to them annually just so that they know and they're aware of what we have. National Institutes of Health, NIH, we work with them, especially with the Office of Science Policy, or OSP. It used to be called OBA, Office of Biotechnology, but now it's OSP, and they are where we get our regulations for recombinant DNA. We'll talk about that here in a little bit. And then for biosafety, we get our guidance from CDC and NIH through a guidance document, or it's actually a book that they provide called Biosafety in Microbiological and Biomedical Laboratories, or BMBL. So yeah, lots of regulations, lots of compliance that we look into. We have 2 locations currently. Before all this happened, we were working on getting 1 location so that we could all be in 1 building. I'm not quite sure where that's going to go, but right now we're located in 2 separate buildings. The office on the building on 1 Morton Drive is over there off of Emmett beside Bodo's and the English Inn. That is more of your biosafety, fire safety, chemical safety. We're all over there. Ergonomics, industrial hygiene, we're all over there. We have offices over there, but we tramps all around grounds. Our special materials handling facility is just like it sounds. We handle our special materials over there. So we collect the regulated medical waste, or RMW, and we bring that over to our facility until the third-party company that we work with can pick it up and take it and incinerate it. We also collect the radioactive materials and let it degrade there. Chemical waste, we collect it there also, and we kind of gather it all and put it in 1 container and then we dispose of it according to regulations. And so when it comes to regulated waste disposal, we have to follow EPA, the NRC, and DEQ. So you can see here, this is chemical waste. So they're taking all the like chemicals and putting them in similar containers. And then once we have enough to collect, we'll ship it off and have it disposed of by a third-party company. Here's our radioactive room, the same type of thing, similar radioactive materials and containers, and they're marked for a certain length of time for them to actually decompose till they're ready to be disposed of. And then here's our regular medical, our RMW guys are picking up these red toters. And then again, the third party will pick those up. So when it comes to lab and chemical safety, we have a whole group dedicated to laboratory safety. They go into laboratories just to ensure, and they do a check of all the laboratories on grounds, not just biological, not just chemical, but all of them. And they just do a general glance to make sure they're following OSHA, EPA, and fire code requirements. They'll also advise on chemical use, how to store them, dispose of them, and any physical hazards they think may be a problem. This group also does our lab decommissioning. So they'll go in and help PIs figure out exactly how to dispose of chemicals, or if they're going to transport or ship their biological materials to another university, or dispose of them before, so that the whole lab can be decommissioned so that another laboratory can move in. They also look for certain things like this. We got some English muffins in here with goodness knows what, but it looks like biological materials. Somebody decided they needed to keep their Ben and Jerry's in the freezer with some biological materials. So that's a little bit of what we also look for, just making sure that nobody's deciding to store their champagne in the freezer or their snack in the fridge next to the toxin, the biological toxins, or next to the chemicals. We just kind of do a spot check because it happens. People just kind of forget they used to be into a laboratory, and then they just start going, oh, it's safe enough. How bad can it be? And they start putting their food in next to hazardous materials. So this is just a little glance into what they find sometimes. When it comes to radioactive materials, it can be radioisotopes like your C14, P32, those type of things. Your irradiators that are found in the hospitals, especially like blood bank, any kind of X-ray producing equipment. This group focuses on that. They have to follow federal regulations with the U.S. Nuclear Regulatory Commission, or the NRC, and we do get inspected by the NRC also. We also have to follow Virginia Department of Health, of course, for the radiological health. And as for UVA, we do have an institutional UVA radiation safety committee. And our radiation safety officer is this gentleman right here, Mike Welling. So he kind of makes sure that everybody's on task when it comes to radioactive materials. When it comes to hazardous materials, they're following Occupational Safety and Health Administration, OSHA again. There is a hazard communication standard. And so we make sure that we have safety data sheets, or SDSs. These used to be called MSDSs, but now they're SDSs. So on our website, we have a location where you can log in, and we have you can look up all kinds of different chemicals or materials and find safety data sheets for all those things. This standard also requires that there's some kind of hazard communication. So we have these hazard communication signs that are you'll probably see them all over, especially in the research area. Medical center, not so much. Where our purview is, there are some locations that are kind of in that gray area of research and clinical that you may see some are signs. And so this is an example of what you would see on that sign. You would see exactly what would be present in that room or possibly present in that room. So it could be biohazards. It could be, you might see a BSL-2 or a BSL-1 here. Most of them you're going to see BSL-2. This is like human blood, that type of thing, is considered BSL-2. You'll find the NFPA diamond that shows you if there's anything that might affect health or could react with other chemicals, or if it could cause a fire hazard. You'd also see if there might be any radioactive materials present in that room, if there's any kind of magnetic devices like MRI in that room, or any kind of lasers in that room. And then you'll also see any kind of special notes about what could be stored in that room or what is required before entering that room. And then you'll also see emergency contacts. This is especially important for if there are emergency responders that have to respond to a room for a leak or a fire, that they know exactly who to contact, who would have the best information about what's located in that room to let them know if they can enter safely. They also follow an occupational exposure to hazardous chemicals in laboratories through OSHA. This details out what you need in a chemical hygiene plan. And you can find that on our chemical safety page. Our chemical safety officer is this lady right here, Clarissa Lynch. They also need to follow EPA for their hazardous waste disposal. And they also follow national and fire codes. So if there's anything in there that could be a fire hazard, they would have to follow that and make sure it's on the NFPA diamond. So when it comes to biosafety regulations, we follow the OSHA bloodborne pathogen standard. For anybody who's working with any kind of human-derived materials, that could be human cell lines, that could be blood, that could be human tissues, anything like that. Again, we also follow the CDC NIH guidelines with that they produce, BMBL. We're on our 5th edition. We're hoping to get our 6th edition out soon. We also follow the NIH guidelines for any kind of research involving recombinant or synthetic nucleic acids. They expanded that from just being recombinant to somebody producing synthetic nucleic acid molecules. Also, we follow the Department of Health and Human Services and the United States Department of Agricultural Select Agent regulations. When it comes to transporting and shipping, we follow the Department of Transportation as well as International Air Transport Association, or IATA. We follow the most stringent, which is going to be the IATA regulations. So they regulate hazardous materials that include explosive, gases, flammables and corrosive, toxic and infectious substance. So our biotoxins would be under this category with the toxic and infectious substances. Radioactive material, our miscellaneous materials such as our dry ice, any kind of genetically modified organisms or genetically modified microorganisms. So we regulate and we guide on those shipping items. So some of the value of training we have found, and mostly because UVA did receive a fine a few years back when there was a person who had not been trained, tried to ship dry ice and didn't ship it correctly, had taped the box up. It was, I'm not exactly sure what they did, but it was kind of the FedEx guy who picked up the box realized it was kind of just must have been sublimating lots of CO2 and realized the guy had not been trained. And so he had to report it to FAA, the Federal Aviation Association, who came to inspect us. That does happen. The Federal Aviation Association and Department of Transportation do come and inspect us. And we did get in trouble. We got fined because they weren't trained. So we amped up our training after that to make sure that people were aware that just because you weren't shipping infectious materials or you weren't shipping chemicals, dry ice is still a regulated material. It's a class 9 and you need to have training for it. So when it comes to biosafety at UVA, we have a couple of different things a couple of different groups that are kind of watching over that. We have the Institutional Biosafety Committee, or IBC. All the researchers would require to register their research with any kind of biological materials, so that this group can review their protocols and ensure that they're working with those things safely. This includes recombinant DNA and synthetic molecules as well. IBC works closely with us, the EHS biosafety group. We try to make sure that the risks are mitigated and that exposures are being prevented. We provide a lot of different biosafety services. So we provide courtesy visits to laboratories, especially new laboratories, before the IBC comes and takes a look and does their inspection. We provide incident investigations. We talk to people. It's not that they're getting in trouble, but it's just that we want to talk to them to make sure that we can prevent the incidents in the future. Because sometimes it's as simple as, let's use a different device, or use a different hand or a different mechanism, or sometimes people forget that they're supposed to be using safety devices. We offer a lot of training, consultation. And then EHS as a whole, we try to facilitate all these safety programs and oversight committees and provide these type of services. So it's not just biosafety that has all these training mechanisms. If you go on our website, we have tons of trainings. If you're interested in anything, we probably have a training on it. When it comes to NIH guidelines, instead of saying this whole NIH guidelines for research involving recombinant or synthetic nucleic acid molecules, we just shorten it to NIH guidelines because that's a lot. And so we need to follow that anytime there's any kind of recombinant or synthetic nucleic acid molecules. And especially we have to follow that if there's any agency receiving grants from the NIH, and UVA does, obviously, we have a lot of those. So we do follow that for safety requirements. So what is recombinant DNA? So to simplify it, it's pretty much you have a specific gene that you want to look at, and you have a host or recipient DNA that you want to use to look at this gene of interest. You put it together using some chemicals to get it to adhere, and then you can look at that specific recombinant DNA in that manner. You'll see that with plasmids and bacteria and viruses. There's all kinds of things that recombinant DNA can be incorporated into. Back to the Institutional Biosafety Committee, or IBC. Again, they comply with the NIH guidelines. They review safe conduct of recombinant DNA. That includes human gene transfer and human gene therapy. So any of this, you may have heard of CRISPR-Cas9, some of these treatments for tumors and cancer and leukemia, those type of things. We have some clinical trials going on that include this HGT. It also includes any kind of creation of transgenic animal or plants. So if you're incorporating some kind of gene into an animal and you're reproducing them or transforming that animal's genetic DNA, then that would be a transgenic animal. And so that's also under the NIH guidelines. And we would have to review that. So we provide approval for all kinds of things: human materials, microorganisms, toxins, viruses, select agents. I am the biosafety officer. We ensure that there's PI compliance, principal investigator compliance, and we report all incidents and file annual reports with NIH OSP if there's any kind of incidents with recombinant DNA. So IBC would help with that. When it comes to biosafety, there are 4 different levels, and we get that guidance from BMBL that CDC and NIH has provided. There are corresponding animal biosafety levels 1 through 4, and all the stuff can be found on cdc.gov if you're interested in more. But generally, just a quick overlook, biosafety level 1 would be agents that are well characterized and that are not known to consistently cause these in healthy that's the biggest term, health adult humans, and it presents minimal potential hazard to laboratory personnel in the environment. Usually work with BSL-1 is done right on the open bench top using just basic microbiological practices. You can see this guy's just walking around doing his work out in the laboratory. He does have a chemical fume hood and he is wearing a lab coat. But for the most part, that's about the majority of it. They have a eye wash and shower. When it comes to BSL-2 or biosafety level 2, they kind of up the ante there. It's for agents that might cause moderate hazard to personnel and environment. It could make you sick. So rabies is one, salmonella, certain types of E. coli can be BSL-2, human-derived materials is BSL-2. So this requires personnel training and handling pathogenic agents. So that makes sure that PIs or lab managers are training the people that are coming into laboratories so they know how to handle these agents. That access to the laboratory is restricted when work is being conducted. So when work is being conducted, you want to make sure that you're not letting any Joe Schmo come into the laboratory to wander around. That you're guiding facilities personnel that are coming into the laboratory so that they're not touching anything that might make them sick. It also includes that all procedures that may produce infectious aerosols or splashes are conducted in some kind of primary containment device. This could be a biosafety cabinet. And you can see over here, this guy's working in a biosafety cabinet and happens to be ducted. Most of our biosafety cabinets are not ducted because biosafety cabinets are actually, they have double HEPA filtration. They have a HEPA filter that air goes through to put air over the work surface, and they have a HEPA filter that goes up and out of the room that HEPA filters the air before it goes out into the environment. It's very unlikely that you would need a biosafety cabinet that would need to be ducted. That's for if you have small amounts of chemicals that you would need to use in the biosafety cabinet at the same time as using biological materials. Let's see, you'll see that he now has a container to put his regulated or his biological waste in. His door sign has biohazard sign. That is another way to restrict access so that people are aware that there's something in that room and it gives them pause before they go into that room. When it comes to biosafety level 3 or BSL-3, that's more for agents that may cause even more serious hazard to personnel and environment. And really the emphasis is on making sure, ensuring that there are no inhalational risk or that people are being exposed to any kind of infectious materials, because these agents in here are normally known to be spread through airborne transmission. There's more emphasis on your primary and secondary barriers, so more of making sure that you have double doors to get into a room. This room would be called an anteroom, where you would don all your PPE before you go in there. And then once it has a shower and eye wash, and once in there, all manipulations would be done in some kind of primary containment device. So either in a biosafety cabinet or in a centrifuge where the cups have O-rings on them so that they're sealed. And then those sealed centrifuge cups are only opened in the biosafety cabinet. Anyway, anything that can produce any kind of aerosols would be done in some kind of primary device or opened in a biosafety cabinet. Nothing is done outside of that. BSL-4, this is for things that are really high risk of life-threatening disease. So Ebola, of course, would be one of those things where there's no vaccine or therapy available. These facilities are usually whole separate buildings. They have their own airflow. They have even more specialized PPE. You see this person in more of like a space suit, and she's got a hose attached, and that hose actually attached to an airflow specifically for, it looks like maybe she's detached. She's getting a little foggy here. She's trying to take over her cell cultures over to somewhere, but she'd reattach to one of these hoses to give her fresh air. Normally it involves being showered in, showered out. There's HEPA filtered air. effluent decontamination systems, where everything that may come out of the sinks and drains in the building will go through a tank that is super highly heated to make sure that anything that comes out of that facility is destroyed and is not going out into the environment. So when it comes to, I mentioned select agents earlier, there are specific select agent regulations. You can find that list on selectagents.gov, but these, because they can be used for more bioterrorism possibilities or risk to the community, there's even more regulations for biosecurity and biosafety. There needs to be a responsible official that is approved by the Health and Human Services with CDC, and that is Tom Leonard in this case. We have to have specific inventory control, so cradle to grave, we have to know exactly where all the agents are. If they're being, if more is being produced, then it has to be documented. We have a whole database for that, and we have to check it quarterly to make sure that there hasn't been any tampering with any of those agents. We have to have heightened physical and cybersecurity. So we have intrusion detection system alarms that if there's any kind of possibility that somebody's trying to break in, the magnet in the door would be triggered, that would trigger the alarm. And then we would have police respond, which we do drills with them, the UPD, to ensure that they can get there within at least 15 minutes to respond to that. We have cybersecurity. So all our information online is locked up. All our files are locked under lock and key. To get access, you have to go through a whole lot of training and background checks and that type of thing. We have written plans that include biosafety, security, and incident response. And whatever we have written in those plans, we have to do. If we change them in any kind of way, we have to change these plans. And sometimes those plans can be changed because we do these annual drills and tabletop exercises to make sure that our plans are working. And if we find that people are doing something different, then sometimes we'll change our plans to reflect that. We also go through rigorous CDC inspections. They usually come every 3 years so that our institution can be registered, that we get re-registered. We just had one last January 2019. Normally, and that's an announced inspection. Normally we'll have an unannounced inspection every 18 months. I don't know if COVID is might influence that a little bit, but normally they're checking in on us, making sure that we're doing the right thing and that we're turning in the forms and the paperwork, and we're reporting all the agents that we have on hand, and we're making sure that personnel that have access to these agents are being put through a background check, a certain process to ensure that they're suitable to handle these agents. This is one of the most highly regulated and security sensitive facilities on ground. So we have to follow a lot of, we have jumped through a lot of hoops and dot a lot of I's and crossed a lot of T's for this. Again, our responsible official is Tom Leonard. He is the director of EHS. He has been approved by the Health and Human Services Secretary. He is the one that ensures that all our select agent regulatory compliance is being followed. We're making sure we're having annual inspection of those spaces, and everything that happens is any deficiencies are documented and corrected. He's allowed to designate a alternate responsible official. Normally we have at least 2 that can be backups if he's not able to respond. Currently it's just me as the alternate responsible official for UVM. So when it comes to OSHA bloodborne pathogens, these are pathogens that can be present in human blood that can cause disease. This can include body fluids, tissues, cells, blood, any kind of thing that's human derived. The requirements for OSHA bloodborne pathogen standard is making sure that people are following universal precautions. So just because your buddy on the basketball team falls down and busts his knee open, you probably should still go get the first aid kit, put some gloves on, and help treat him that way. You want to assume everybody, there's a potential for pathogens in the blood. And that can be hepatitis B, hepatitis C, HIV, those type of things. Those are the ones that we are most concerned about, but there are many, many other bloodborne pathogens. We have to have a written exposure control plan when you're working with the laboratory and you've registered with the IBC and you've been approved. At the end, we have it so that it automatically pulls from the IBC registration into a document that is the biosafety manual, but also an exposure control plan is pulled into there if somebody clicks that they're using human-derived materials. And that includes information about work practices, mitigation to sharps, disposal of regulated materials, that type of thing. Also, we're required to provide hepatitis B vaccinations for those who need them, or make sure that they've had a titer to make sure that they're up to par, or they're able to decline if they don't want to. And of course, they can always come back later after they decline to say, hey, I want that vaccination series now. We have to provide hazard communication, just like chemical safety. We piggyback off that. We use that hazard communication sign to incorporate our BSL2 saying, hey, there's hazards in here. Also, that includes the biohazard labels you'll find on freezers and incubators and that type of thing where these items are stored. Medical services. So we have UVA WorkMed that we use for researchers, and they provide visits for the researchers to ensure that they're had the proper consultation and that they're being provided the proper vaccinations and guidance. I've talked about regulated medical waste quite a bit. We also call it RMW. So we follow Virginia Department of Environmental Quality, DEQ, to ensure that we are following their regulations for disposal of any kind of biohazardous waste. We perform most of the waste management. UVA Medical Center, they actually autoclave all their waste out. We usually do most of the researchers, but sometimes we do pick up for some of the outside clinics. So some of the things that can be considered RMW are stocks and materials contaminated with microorganisms that might be pathogenic to healthy humans. It can be unfixed human materials. It can be that are in the form of liquids. It could be sharps, any kind of needle or scalpels that have to go into a sharps container and then be disposed of as RMW. And any kind of contaminated disposal can be kind of your other. So for the researchers, we use this box here that we call a contaminated materials container, or CMC. And we provide the boxes and the bags in certain locations in the research areas that the researchers can come pick up and take up to the laboratory, fill up. Housekeepers can pick it up and then take it to a special area where we'll load it up from the loading dock and take it to our facility for a third party to pick up and take for final incineration. I just talked about sharps, any kind of sharps, anything that you think that could puncture human skin would go into one of these sharps containers. It has to be a hard, rigid plastic container. This could be needles, syringes with needles, scalpels, suture needles, glass pasture pipettes. We're trying to get everybody away from glass pasture pipettes, but sometimes they're still around. Any kind of lancets, slides, glass slides, cover slips, that type of thing, especially if you have glass slides and cover slips that are just wet preps that haven't been fixed with a preservative that actually would kill the organism on that slide. Capillary tubes, any kind of contaminated broken glass or other sharps container. So contaminated broken glass could be a glass tube that somebody's using that they dropped that had any kind of infectious materials in them. So we do provide consultation, as I mentioned earlier. One of the best things that probably has started is we started an onboarding process to welcome new PIs. And that way the PIs get an overview of everything they need. We end up getting a little bit more compliance, and they understand all the forms they need to fill out, how they're disposing of all the different waste, chemical and biological, what trainings are necessary, what medical counseling or medical appointments are needed. And so, again, we provide them lots of information to give them a more quick laboratory safety startup. We make sure that they just are able to begin a lot quicker, so that because they know all the compliance issues that we're having to follow, all the regulations and guidelines and policies. And so they can call and set up an appointment. And a lot of times we kind of hear by word of mouth, oh, we've got a new researcher coming in. And then we contact them and say, hey, let's set up something. So we make sure you've got all the information. So when it comes to incidents and reporting, we like to, if there's any kind of incident, especially if it involves any kind of regulated hazardous materials, report that to us. We like to make sure that we look into that and see if there's any kind of unsafe conditions and if we can help in the future to prevent that. If there is any incident or accident or exposure, people should first seek medical attention or consultation with UVA workmen. Sometimes it's not necessary to go in, but sometimes you can just call in and say, hey, this is what happened. Do I need to come in and get an appointment? And if it's for severe injury, of course, UVA emergency room is available for any kind of severe injury. Or even if it's on the weekends and the person doesn't feel like they can wait. UVA WorkMed is only an 8 to 5 gig. And so if you're injured within that time, you can contact them or at least leave a message so you can get information the very next morning. So that is all I have. Are there any questions?
I have a quick question, Jenny. My name is Susan Hennigan. I was just wondering what levels of labs does UVA have? Do we have BSL 3 and 4 labs?
We definitely do not have BSL 4.
Yeah.
There's only a couple of locations in the United States that is able to accommodate those certain containment levels. We have up to BSL 3. Okay. And we do have select agents. Most of our lab, and like I said, that's a very highly regulated, very secure area. We have jumped through a lot of hoops for that. We do have, our majority of our laboratories are BSL 2.
So we, for instance, could not work on a live COVID virus, right? We couldn't, or could we?
We have BSL 3. We have BSL 3 if anybody's working with the virus itself.
Okay.
So if you're working with blood or human materials that from a patient that is infected with SARS-CoV-2 or is diagnosed with COVID-19, then that can be handled at BSL 2.
Okay.
Yeah.
Thanks.
Sure, no problem.
Hi, Jenny. I have a question. My name is Ian. I'm from the Department of Biomedical Engineering. I saw that UVA is testing COVID-19 spread through testing sewage to see if the spread has been around that building and so on. So was your department involved in that process?
So our department hasn't been so much involved with that. The IBC did approve that protocol. That's mostly been going through Dr. Amy Mathers. She is the assistant director of the clinical microbiology laboratory. She runs a sync lab, and this kind of went into that whole waste contamination, what she focuses on. And so she's kind of run with that, focusing on that. Now, we were highly involved with VPR, Vice President for Research, was highly involved with making sure that we got the Be Safe program up, which is the saliva testing program.
Cool, thank you.
Yeah, absolutely. Well, thank you guys so much.
Thanks, Jenny.
Thank you.
Absolutely.
Thanks.
Hi, Michael.
Hello.
How are you? I'm Rita Lamb.
Good to see you.
Good to see you too. Welcome and thank you for the volunteering of the presentation today. We've had a great 6 weeks so far. It's our 7th session. And so we pretty much always have around 20, 25 people on every week. And some are getting ready for exams. Some are just getting in the mindset of taking the exam. But we explained at the beginning of the session that these are recorded, and we're going to send the information out afterwards, and that way they can use it to review for their upcoming exam. If they have any questions, we have the chat function that seems to be the best way to communicate when you're speaking. And then afterwards, if they have questions, they can certainly email myself or you or Jenny, and then we kind of go from there. So that sound
All
okay?
right.
All right.
Sounds great.
Thank you.
Yeah. So I have share screen capabilities here. Is that right?
Yes. Mm-hmm.
Let's see here.
At the bottom.
Yep. Let's see. And
Very good.
I want to get it in full screen, right?
Yeah. Okay.
All right. So what do you see? Do you see speaker view, or
We see both. Yes.
you see both speaker view? All right. Let's see here. Stop share. Do this again and see what. How about that?
Perfect.
Perfect. Great. All right. Let me figure out how to advance my slides and I'll be in good shape. Okay, perfect. Great. So is now good? Am I good to go?
Yes. If you want to go ahead, that would be great.
All right. And I have how long?
We are here till noon.
Oh, and you definitely don't want me to go until noon. So I will do my best.
Okay.
So I've done this talk for many years now, and I guess I'm always surprised by the questions that people surface as test questions that they've seen in their prep materials. So please do feel free to interrupt me at any point if you have a question that you think is relevant to the topic on the slides. I want to make sure that we make this useful and that you can actually pass this test if and when you decide to take it. So my name's Michael Stratiff. I'm the executive director of the UVA Licensing and Ventures Group, and I put this background up not to talk about my background too much, but to communicate that I've been doing this university technology transfer and commercialization kind of my whole career, and the only other thing I've ever done is I was a patent examiner at the United States Patent and Trademark Office. So the contents of this slide deck are really all I'm qualified to talk about, and so I'm hopeful that it checks all the boxes for you and gets you the information that you need. I did go over the content outline for the body of knowledge, and these are all of the topics that I saw that kind of touch my world at the university, and so I'm going to try to focus on these points. But I always like to start with an example because I feel like often the important people like you maybe forget or don't get to see many of the things that you're working on come to fruition. And so I just wanted to put this up because I think it is one of the best examples of the effectiveness of UVA sponsored programs infrastructure. This is Boris Kovachev. For those of you that know Boris, you'll appreciate that's probably the single largest smile I've ever seen him crack. He's pretty stoic, but in 2013, Sanofi, global pharmaceutical company Sanofi, approached Boris, and they said they had a problem. They wanted to predict HbA1c, which is a measure of a patient's management of their diabetes using what's sparse data, finger stick data. And Sanofi, a world leader in the manufacture and sales of insulin, came to UVA and said, boy, we want to do this. Can we do it? And I think the important part here is that in a very short period of time, a pretty complex sponsored research agreement was negotiated. An actually relatively small sum of money was transferred to the university to perform the research. And Boris actually solved their question. We've subsequently licensed that technology as called out in that sponsored research agreement to Sanofi. And now millions of patients throughout Europe are using this device for HbA1c prediction. And so, though I know it feels like day to day, at least what I'm doing is just moving papers from one side of my desk to the other, this does have real world impact and patient care benefit. And I like to make sure everybody's still, you know, touching that in some way, because I think it helps you get up and go to work each day. So I'm gonna try and give a little bit of framework, and you'll have to bear with me because I go back quite a ways historically, but this portion of the talk is really to establish what I think are some first principles that we'll use for the rest of the talk. So innovation at UVA, this is something I'll keep coming back to. The United States Constitution sets forth the purpose of the intellectual property system in the United States. And the purpose is to promote the progress of science and the useful arts. We, as a university, really embrace that idea. You know, patents can be used for many things, including not promoting the progress of science and the useful arts, but we really try to adhere to that value. And if and when you come to a question on your exam that you don't understand what they're asking, if you think back to what would optimize the progress of science and the useful arts, that's a first principle that I think will be important. You know, Thomas Jefferson, also an inventor, but where a new invention is supported by well-known principles and promises to be useful, it ought to be tried. Again, the key here is promote the progress of science and the useful arts. It ought to be tried. Then, you know, from 1810 to really 1980, not a lot happened that was useful for this talk. So I'll jump to the Bayh-Dole Act of 1980, where again, we reinforce this premise. It is the policy and objective of the Congress to use the patent system to promote utilization. Progress of science and useful arts, it ought to be tried, promote the utilization of inventions. These are all really important points. The one test question that I found was about the Bayh-Dole Act. Which of the following is the document which deals specifically with patent rights and responsibilities currently applicable to universities under federally sponsored projects? It's 37 CFR 401. That is the codification in the Code of Federal Regulations of the Bayh-Dole Act, which is also called the University and Small Business Patent Procedures Act. Sorry to dive into what I think is kind of a nerdy detail, but I think it was a test question. So there you have it. You're up to one of however many questions there are. But I think importantly, we try to frame what we do in the context of the university's objectives. And President Ryan, when he unveiled his 2030 plan, said, I believe that we should strive to be both great and good in all that we do. And as we all frantically tried to figure out what he meant by that, fortunately, he offered to us his more specific strategic plan, which suggested that one of the goals is to enable discoveries that enrich and improve lives. So for LVG and for research commercialization, the important part of that is we are to enable discoveries to enrich and improve lives. The research will take place at UVA if I'm not involved. The commercialization, and therefore what I'd argue, the impact on human lives is diminished if we don't engage in commercialization. So what does commercialization mean? For me, the two mechanisms primarily that we deliver knowledge born of the university into the world is via commercialization provisions granted in an industry-sponsored research agreement and or in a technology transfer agreement executed by the UVA Licensing and Ventures Group. And we'll talk a little bit more about each of these as we go through. A generic way to think about this is OSP negotiates agreements where industrial engagement happens prior to the creation of intellectual property. My job is primarily dealing with the intellectual property after it's been created. But it is admittedly not the easiest environment to engage in commercialization. We are a nonprofit. We have tax-exempt bond finance buildings. There are government constraints. We have a diversity of stakeholders. and fiduciary responsibilities to each of them. We also have hundreds of thousands of agreements that govern our behavior. And so there are constraints on that activity. But importantly, I think we have values that encourage dissemination. And so all of the major organizations to which UVA belongs, AAMC, the American Association of University Professors, the Association of University Technology Managers, et cetera, all value as one of our highest objectives dissemination of new knowledge. But then, so the hierarchy here is we have to know our constraints, we have to manage our constraints, but we also have to know, importantly, our values. And only then do we get into our interests, the specific terms and conditions of the agreement. But just to give you an example as to how much we value dissemination, here is a provision borrowed right out of our license agreement. And it says, licensee shall use its best commercial efforts to achieve expeditious practical application. And that P and that A of practical application are capitalized on purpose. And they're capitalized because those are terms straight out of the Bayh-Dole Act. Our job is to make sure that federal research expenditures benefit the public. And so we obligate our licensees of our intellectual property to use best efforts to achieve commercialization. Because again, it ought to be tried, and we need to encourage the progress of science and the useful arts. But if dissemination is the highest goal, why not just give it all away? So I think this is a reasonable question for a university to ask. And I think that the key is the challenge associated with the details. To whom do you give away the intellectual property? If it's to everyone, what is the incentive to make the continual investments necessary to go through a regulatory pathway or to engage in the marketing and distribution if there is no means for market exclusivity from which you would cover those costs? I would argue that it also diminishes incentives to invent innovators, and we'll talk about that a little bit more. But there are, importantly, many other considerations. We have risk management issues. You'll come to know and love indemnifications, disclaimer of representations and warranties, and insurance provisions. We always reserve rights to continue doing what we do inside the university, our academic and scholarly purposes. And these kind of get into a bunch of details, kind of again, nerdy stuff about license agreements. But there are lots of specific terms and conditions that constrain our ability to engage in commerce in the same way companies do. But for me, that's important because I think it gives us a North Star, a higher objective that is dissemination of knowledge that I find really attractive. Okay, so I'm going to break for just a second. So that was the philosophical framework for kind of what we do. I'm interested if there are any questions or concerns or questions that anyone has at this point, because if you don't buy that, the rest of this you're really super not going to care about. Are there any questions? Asa Lopatin, do you have any questions? All right, hearing none, I'm going to move on. Okay, so I know definitively that a bunch of the stuff in this next session is one of the focus areas for the test. So I'll try to highlight some things as we move through here. I'm also a big believer in repetition. So when I say a bunch of these things over and over again, it's probably because I think it's important. And it might
Michael.
Yes.
Sorry, I was struggling with the double Zoom. I just had a question about one of the things that you mentioned.
Yes.
So you said, why not just give it away? At least in some circumstances, aren't we prohibited from doing that by Bayh-Dole?
Yes. So Bayh-Dole, and we'll talk about this in a little bit more detail, but Bayh-Dole obligates the university to be the party that elects title to an invention, so that we are obligated to own the invention, and the only other party that can do so is the federal government. So in the event that there's commingling of funds, the federal government does in fact say that we can't assign title without their consent. And in fact, the process that you go through is you waive title to the government, and then the government cedes title to the third party.
So that actually is a process?
It is the process, yes.
Thanks, I just didn't want you to be bored.
Thanks. Okay, so intellectual property. So we've talked about the philosophy behind why we try to commercialize the results of our research. Now we need to talk about what the results of that research can be. And we talk about those, generally speaking, in terms of classes of intellectual property. And so again, the legal basis of intellectual property, it was important enough for the founders of our country to put this in the Constitution. There's actually not a lot of stuff in the Constitution, and this was one of them. The Congress shall have the power to promote the progress of science and the useful arts by securing for a limited time to authors copyrights and inventors patents the exclusive rights to their respective writings and discoveries. So there are 4 primary types of intellectual property that you deal with. And I'll move through these quickly because I know a lot more about some of them than I do about others. You know, the first form of intellectual property is a trade secret, and it's the starting point of all intellectual property. If and when you come up with an idea before you have told anyone, it is in fact a trade secret. Universities aren't tremendously good at keeping secrets, and therefore we don't engage in trade secret practice very much. If our whole objective is dissemination of knowledge, and we do that by educating students and by publishing papers, trade secrets aren't a great form of protection. But it can be applied to any formula, pattern, manufacturing process, et cetera, that gives to its holder a competitive advantage. The key about trade secrets is it's a reasonable form of protection as long as you can keep it a secret. But if you can't keep it a secret anymore, you've lost all of your forms of protection. The example that many folks use, and that's an easily identifiable example, is the recipe for Coca-Cola. Theoretically, no one knows what that whole recipe is, but as a result, and also you can't buy a Coca-Cola and then figure it out by combining all of those ingredients that are written on the can. So it's a good form of protection for something like Coca-Cola. It wouldn't be a great form of protection for something like an iPhone, because you can take it apart and understand what's inside of it by virtue of the connection of the components together. Another type of intellectual property, patents. This is the bread and butter of the Licensing and Ventures Group, and I think honestly the provision that dictates the language in most sponsored research agreements. It is a patent for an invention is the grant of a property right to the inventor issued by the United States Patent and Trademark Office. The purpose here is, in order to promote the progress of science and the useful arts, if you are willing to publicly disclose the invention that you've come up with, in exchange for that public disclosure, the government will give you the right to exclude others from doing something, your invention, for a period of time. Okay, so it is a contractual exchange, public disclosure in exchange for the limited right to exclude others. There are 4 types of of patents. There are provisional patents. Think of a provisional patent as a bookmark. It is marking your place in line at the United States Patent and Trademark Office and giving you the right for 1 year to file what's called a utility patent on your idea. A utility patent is the patent that we all think of. It is examined by a patent examiner. We'll talk about that. There is a term of 20 years from the filing date. So when you file, you have 20 years if your patent is granted to exclude others. A key question in all of this is your idea worth it? just for context, it probably costs the UVA Licensing and Ventures Group $20,000 to $25,000 to prepare, file, prosecute, and maintain a United States patent over its life. So when you're thinking about, is my idea worth it? If you can't contemplate a way where you would make at least $25,000 off of your invention, I'd suggest patenting is not the best plan. So there are considerable costs associated with these filings, and as a result, they need to be recognized as a tool of commerce. If what happens is you prepare and file a patent application and then don't actively practice your invention, you may have inadvertently actually stifled the progress of science and the useful arts, because no one is benefiting from the invention. So again, that manifests itself in license terms and conditions and in sponsored research provisions that obligate a licensee of UVA's patent rights to use best commercial efforts to seek its dissemination. There are also design patents. These are granted on an ornamental design. Famous design patents are the fender of a Corvette, or the actual outline, button, and speaker hole of an iPhone is actually a design patent. And then there are plant patents, and plant patents are on asexually reproduced plant matter. We don't have a lot of plant patent work at UVA, so I don't know a ton about that. But as I mentioned, patent applications are a written document that is disclosed to the United States Patent and Trademark Office. In exchange for that disclosure, if there is in fact an invention in that disclosure, the Patent and Trademark Office will give you the right to exclude others. How do they determine what the invention is? Well, there are 4 conditions of patentability. I list the code here because the one question I saw indicated that there was interest in knowing where this stuff is codified. 35 USC 101, 112, 102, and 103 are the 4 sections of the United States Code that govern patentability of subject matter. And we'll talk through these briefly. So 35 USC 101 is what's called the eligibility utility condition for patentability. Whoever invents or discovers any new and useful, and here's what's patentable, process, machine, manufacture, or composition of matter, or any new and useful improvement thereof, may obtain a patent, therefore subject to the conditions and requirements of this title. This is the class of this is the determination provision that also governs that that naturally occurring phenomenon and mathematics are not in fact patentable subject matter because they are not new and they do not fit into these patent eligible subject matter classes. So 35 USC 101 rejections come up a lot on software and on early stage life sciences technologies, particularly diagnostics. 35 USC 112 is the enablement and written description requirement. The important point here is, as I mentioned, in exchange for your public disclosure of your invention, the government may give you the right to exclude others. But you must disclose your invention in such full, clear, and concise and exact terms to enable one of ordinary skill in the art to practice the invention. You can't withhold the key ingredients to your recipe. You can't withhold the important features and still get a patent because the patent is conditioned on your full disclosure of your invention. 35 USC 102 is novelty. This is what we all think of when we think of patents and inventions. It must be new. But in fact, above being new, it must also be non-obvious. Okay, so this is another important point, that if you take your invention and your invention would be obvious to one of ordinary skill in the art based on the full available data and information that existed in the world at the time of your invention, it is also not patentable. So more specifically, if you take 2 things that were known in the world and the 2 things are logical to be combined, and you combined them, that means your invention is likely obvious. Even though no one has identically disclosed your invention before, it would be obvious to one of ordinary skill in the art at the time the invention was made. This is a very, very litigated and argued component, and it's why patents cost so much and patent attorneys cost so much, is because they spend all of their days arguing about what would be obvious to one of ordinary skill in the art at the time the invention was made. But those are the 4 requirements for patentability. Is that all making sense? I can't even see nods, so I'm assuming if you don't object vehemently that it's good, you're feeling good about things. Okay. Some important points. Inventorship's very different than authorship. And so it's really important to identify who in fact are the inventors of the patentable subject matter. When in doubt, ask us. And another reason that this is important is you will hear frequently in sponsored programs and in research administration, the concept that ownership follows inventorship. If someone at UVA invents something, UVA owns it. If someone at a company invents something, the company owns it. If they invent something together and there are 2 inventors, one from the university and one from the company, it will be jointly owned. So there are provisions in many of these agreements that say ownership follows inventorship in accordance with inventorship in accordance with United States patent law. There are lots of resources. There are even resources listed in the Certified Research Administrator study guide. And I just listed a couple here. I have spoken primarily about United States patent law. And that you need to recognize that patents are geographically restricted. A United States patent only protects you in the United States. If you want to exclude people from doing your thing in the UK, you need to file a patent application in the UK. And there is this World Intellectual Property Organization and a process called the PCT process, where you can prepare and file patent applications globally. But I think that probably is a little beyond the scope of this, but you need to know that vehicle exists. Okay, copyrights. So we talked about trade secrets, we've talked about patents, now let's talk about copyrights as another form of protection. A right that protects original works of authorship fixed in a tangible medium of expression, okay? A copyright does not protect the ideas embodied in the work, only the embodiment of the work. So a good example is a recipe. A copyright on a recipe will permit the owner from keeping people from reproducing the recipe, but not from making the food. Okay, so in many forms, the order of the words on the page, or the order of the code, or the graphical depiction, or the imagery is incredibly important. And in that context, copyrights are a very important form of protection. But in the case of, for example, computer code, the code itself can be copyrighted, but the ideas embodied in the code may be better patent protected, okay? The term of a patent is at least 70 years, but it depends on in what capacity the author was working and for whom. Different from patents, the copyright is automatic upon fixation. So as soon as the work becomes fixed in a tangible medium of expression, the patent is the copyright is the world is on notice that it's copyrighted works, and those copyrights can in fact be registered with the Library of Congress, and that's an important step if and when you anticipate litigating the copyrights. But again, it does not protect the ideas, but the creative expression of the ideas. Okay. Okay, last primary form of intellectual property protection is a trademark. These are non-functional word, logos, slogans, symbols, designs, etc., that distinguish a product or service. Trademarks are typically used later stage in commercialization because they differentiate a product or service from other products or services. Whereas the university is primarily engaged in the development of technologies that have not yet become products and services. So we don't do a ton with trademarks, but we do a little. As LVG, the university obviously does a ton with trademarks, right? So you can see our LVG logo in the bottom. The university's very protective of its trademarks, but LVG doesn't manage the university's University of Virginia trademarks or their athletics logos. But here are a handful of examples of trademarks. IBM, Google, GE, these are all now colors and scripts and easily identified marks that for us really clearly differentiate their products and services. Interestingly, colors can be trademarked. There's only one company that can make pink fiberglass insulation, and that's Owens Corning. The red sole of a Christian Louboutin high heel is trademarked as well. These are, I put in redundant slides in here, and I put them in here because I'm going to share these slides, and there's more information in here than perhaps you'll need, but I did put some redundant slides in. Okay, so licensing. So now we've talked about why we would want to disseminate our knowledge, how we would protect our knowledge, and now we're going to talk about how we would get that knowledge that we've protected into the hands of third parties. So we do that via licensing. And I put up here, just because I think that it's tremendously illustrative, the license grant from our license agreement. And it says UVA LVG hereby grants to licensee, and licensee hereby accepts an exclusive right to use licensed patents to make, have made, use, import, offer for sale, and sell licensed products in the field of use, and a non-exclusive worldwide right to use licensed know-how. Okay, so a couple of important points here. We do grant exclusive rights to third parties in the event they're committed to deploying that technology. We don't, however, non-exclusively license something that doesn't have a fixed property right associated with it. Our goal is to disseminate the knowledge, the know-how that we have, to enable the licensees of our licensed patents to fully exploit them. But we also can't restrict our ability to permit others to use that same know-how in the event that it's applicable to other licensed patents that we file. So this is, I mentioned that we grant intellectual property rights to third parties in two mechanisms: the license agreement that is post the creation of the intellectual property. We also do it in sponsored research agreements that are pre the creation of the intellectual property. And what I've put in here is a very oversimplified depiction of the IP alternatives that are frequently negotiated in industry-sponsored research agreements. So you can see there on the left is UVA's template sponsored research agreement. The continuum is that as we move from left to right, the grant of the university's rights to the university's intellectual property is more significant and more complex to negotiate. And as a result, we start at the left, but we frequently move to one of these other boxes here on the right. And I think the key here is simply to say that these are ideally negotiated on a case-by-case basis if we're trying to optimize both the outcomes for the licensee and the sponsor. And there are all kinds of different constraints that prevent us from going all the way to the right in many cases. And again, that drives our preference toward the template provision there on the left. But I copied the intellectual property provisions of a research funding agreement here. Asa actually sent this to me at like 9 o'clock this morning. So I want to go over this because it reinforces some of the things that we talked about. So you can see intellectual property means patents, copyrights, and other intellectual property rights. Okay, so we talked about patents and copyrights. Project IP means things that are conceived or developed in the performance of this work by employees of the university, because inventorship or ownership follows inventorship. Joint IP means intellectual property that is jointly invented by sponsor and university. So we say we will own, right? This is the inventor's ownership follows inventorship provision. But what we say is if we invent something, sponsor, we're going to tell you about it. And we're going to tell you about it in a confidential written disclosure. There's an important premise here, in that it's in the event that we just told them via the publication of a paper, it's highly likely that we've significantly jeopardized our intellectual property rights. Remember, what's the purpose? The purpose is to promote the progress of science and the useful arts by incentivizing public disclosure. If you've already disclosed your invention via a publication, the government doesn't really have to give you a right to exclude others in exchange for that disclosure, because you've already done it, okay? So the key here is the quid pro quo. You get the right to exclude others if you disclose to the United States Patent and Trademark Office first, in exchange for a right to exclude others, okay? In the United States, you have a 1-year period from the date of your public disclosure of your invention to prepare and file a United States patent application. Upon publication, however, you have likely immediately voided many of your patent rights outside of the United States. This is why sponsors want to review draft manuscripts in sponsored research agreements, and why provisions concerning proprietary and or confidential information are so important in sponsored research agreements, because once an invention is publicly disclosed, patent rights are in jeopardy. So we say we will file patent applications. We grant to the sponsor the right to use our project IP for internal research and development purposes, but we also grant to the sponsor the right to negotiate with the university for an exclusive or non-exclusive license for all purposes. So we say, look, you sponsored this work, you get the first try to license this technology from us, and for 90 days, we'll negotiate with only you about those terms and conditions. Okay, so that is Section 7 of UVA's Industry Sponsored Research Funding Agreement, and the kind of the aggregation of all of these ideas that we've talked to up to this point. So negotiation, this is unsolicited advice. I just saw negotiation was part of negotiation strategies as part of the test material. I give a talk to undergraduate engineering students on negotiation, and so I just had 2 slides handy. I think before any negotiation, you need to know what your style is and resist temptation to adopt a methodology. There's all kinds of mythology about negotiations. You must put the first offer forward, so on and so forth. I think you just have to think about your hierarchy of interests, values, positions, etc., and move through those in a way most comfortable to you. Another point I try to make frequently is you can't memorialize or contract for trust. If you don't trust the party that you're trying to negotiate with, it's highly unlikely that you'll reach agreement, because you'll try to make the agreement so locktight that you'll never meet the end. I encourage us to only engage in negotiations in which our desired outcome is agreement. I don't think we should reluctantly go into negotiations where we don't really want to do it, because it takes too long and occupies too much time, bandwidth that we could apply to agreements that we want to do. You do need to know your BATNA, which this is the best alternative to a negotiated agreement. What happens if you don't get the deal done and do have a point at which you'll walk away? I think you should be cognizant of accumulated concessions. when you're negotiating sponsored research agreements, there is such thing as a death by 1,000 cuts, where at the end of it, you say, boy, we violated all of our values and we shouldn't really want to do this. But most importantly, I think in preparation for a negotiation, you need to know yourself. Know your values, know your priorities, know your interests and your positions in your agreement, and move thoughtfully through all of those things. During a negotiation, I find that just asking why people are taking the positions that they're taking is an incredibly productive step, because often when people communicate why, you can address the why. What you're objecting to is the actual words on the page that address the why. Be transparent and justify your positions. Be well educated as to why the university can and can't do certain things. Require contractual clarity. Be patient, and think of, particularly in the university environment, think of the negotiation as the start, not the end of the relationship. We are engaging in long-term relations with the parties that we negotiate with. Unlike other transactions in your life, real estate transactions or buying a car, you may not want to form a long-term relationship with the car salesman that sells you a car, but you probably do with a sponsored research partner who is going to engage over 5 to 10 years in university research. All right, conflicts of interest and outside interests. So my job at the university is to create conflicts of interest, okay? So I am very cognizant of and spend a lot of time trying to help the university manage the conflicts or outside interests that I create. So what do I mean by that? We're engaged in commerce. If and when we do a license agreement with a third party, the inventors themselves receive 35% of any and all income that we create. Frequently, too, those inventors themselves go on to reach other agreements with our licensees, be them consulting agreements or taking equity in newcos. And as a result, they have to disclose and manage that conflict when they're engaged in subsequent university research on the same topic. Okay, so we execute about 80 license agreements a year, including the launch of between 5 and 10 new companies. That is at least then 80 new conflicts of interest that come up each year that need to be managed. And that's exclusive of pre-existing consulting agreements and things like that. So again, I believe that the trend in academia is not the more historical ivory tower, avoid conflicts of interest at all costs. Instead, I believe it is manage prudently conflicts of interest, err on the side of public disclosure, and therefore ensure that the integrity of the performance of our research at the university is not violated. So that is probably a little bit of a I don't want to call it a contrarian view, but I think that the key for people like us that are administrators at the university is to recognize that in engaging in commercialization activity, university innovators are trying to heed what is our highest objective, and that's dissemination of knowledge. And therefore, we should be working with them in partnership to help them manage their conflicts of interest rather than forbidding them. I mentioned that we invest in companies. So here is a list of companies that we've invested in. We run a $10 million investment fund. So the university obviously believes in this enough to think that we should invest dollars in companies founded to commercialize university research. And here is a list of those companies. I think this is to reinforce the point that the university does not object to the creation of conflicts of interest, and in fact contributes meaningfully to creating those conflicts of interest via investments in LVG, and more specifically in investments in the LVG seed fund. And people, real companies with real deep pockets, invest alongside us because they believe university or research born at UVA is important and commercially valuable. Santen is a pharmaceutical company. Chevron, we all know. Blue Bear, Graybird, Blue Bear are all very sophisticated intellectual or venture capital organizations that invest alongside UVA LVG in our portfolio companies. This is a slide that just shows key metrics of success. The bars are UVA's research expenditures. The blue dots, though, are UVA's invention disclosures. So in 2019, we received 238 invention disclosures from faculty, staff, and students at UVA. We filed 125 provisional patent applications, 52 United States patents were issued, and we executed 78 commercial transactions. So this is a high volume business for UVA. We have a highly innovative faculty, and their ideas are relevant in the marketplace. So I think that's, again, reassurance that what you do is really important to permitting this to continue happening. And that is it. So I'd love to answer any questions. I would particularly love to answer any questions that you found in your test prep that you felt I did a poor job trying to cover. Any questions?
Hey, Michael, thank you for the presentation. It's great. I just want to ask on the equipment fabrication and how do you deal with this with LVG?
Equipment fabrication. Give me some more. Give me some more on that.
So when we we are dealing with I remember from my past experience, some labs buy piece of equipment to build robots for labs to do some kind of automation to the lab processes. And sometimes it could be captured as capital equipment if you are going through the same process. We learned about this. There's a form for equipment fabrication. And maybe that will not be captured because it's something that the PI or his lab is doing to expedite the work. So does the PI or his grant administrator should notify you when you do the develop this kind of robot or this kind of automation in their lab?
Yeah, so my general guidance on all things disclosure and the need of faculty members to disclose or not is, when in doubt, disclose to us. The worst case scenario is that we say, this is not something best disseminated via commercialization and maybe best disclosed publicly in a manuscript or whatever. I think the reason I say that is I think at least twofold, and I'll probably think of more ideas as I go through this. But the first is that I find that faculty innovators are often the least qualified to assess whether or not something they've done is in fact novel. And I say that with all respect and not meant to be disparaging. In fact, the contrary.
Yep.
Faculty members have a tendency to believe that many of the things that they do are the next logical step in their scientific process. And they forget that that next logical step is likely only logical to them based on years and years of study of a very concentrated field of endeavor, okay? Mm-hmm. And so if you've spent your entire career studying a particular biological mechanism, and then you invent a way to interrogate that mechanism, you may think that that's just the next step. And so I always encourage disclosure to LVG to get it outside of the confines of the people that know this stuff inside and out, and let them take an objective view of what constitutes invention or not. The other more procedural part, though, is that if you are in fact aggregating off-the-shelf parts in novel ways that is patentable subject matter, but also could be our utilization could be governed by the terms and conditions upon which we procured the constituent parts. So to engage in university research, we typically think about the sponsorship of the dollars for the time that our people will dedicate to the research. But like you said, we use tons of equipment in the performance of this research. We use data sets. We use all kinds of different information, in many cases that we've procured for specific purposes on specific terms and conditions. So if and when you start using those things in ways that perhaps weren't contemplated at the time of their disclosure, or I'm sorry, the time of their procurement, it could be that it would be useful to ensure that we're not integrating things in ways that we're not permitted to do. An example that comes up frequently is in the life sciences world. We receive, I'm sure, thousands of materials via materials transfer agreement, and many of those are restricted for use in a particular lab in a particular experiment. If the PI in that lab running that experiment then gives that material to a colleague for another purpose, that can be in violation of the terms and conditions of the MTA, and we'd want to memorialize that change with the sponsor. So I think there are lots of reasons to engage early and often with LVG as you're moving through your research program. I don't want to advocate that the tail wag the dog, that innovation be the key, driver of behaviors. And so we try to integrate real clearly into the workflow of the faculty members so that we can do our assessment in parallel with their work. Did that answer your question?
Yes, definitely. I see.
Perfect.
Thank you so much.
I see a question on the chat. If you have a copyright that results from a federally funded grant, what is the government's right to that material? I believe the answer is it depends. Sorry for that, but I can think of at least a handful of examples where, for example, in ed content, the IES, Department of Education IES grants require, I believe they were talking about dedication to the public domain and or open sourcing all copyrighted materials that result from their funding. There are increasingly requirements for open sourcing software that results from federal grants. So I think this is primarily going to be dictated contractually by the different agencies at the time of the research funding agreement. I don't think that, and Asa may know too, or somebody else on the call may know, I don't think there's not as comprehensive a government policy on copyrights as there is on patents with Bayh-Dole. Jody, did that answer your question? I'll hope so.
Yeah, I suspected it was not an easy answer, but I ran across that question in one of my test prep questions, and it had a lot of fuzzy answers. And one of them was, I think one of the answers was it'll be dictated in the notice of award if the government is requiring a non-exclusive, irrevocable right to yada, yada, yada.
Yeah, my guess is that a condition of the Bayh-Dole Act on patents is not only that, so we get the right to elect title, to own our invention, but that is in exchange for a grant of a non-exclusive royalty-free license for any and all purposes to the government. My guess, even though I still would assert that it's going to be dictated by the terms and conditions, I would think the default is at least going to be some kind of non-exclusive grant to the government. in a royalty-free way, because the government is not going to fund a bunch of research to have people create things to go then assert those rights against the government. So I think that's the default. My comment is more about beyond that, what do I think the expectations are? And I think those will be dictated by the terms and conditions of the grant. What else?
I have a question about software. Is it generally protected by both copyright and patent? And then you mentioned earlier that I think it was 35 USC 101,
Yes.
that sometimes software is rejected under that. Can you explain a little bit more about that?
Certainly. Okay, so the answer is software can always be protected by copyright because it is code fixed in a tangible medium of expression. So provided that it's original code, it can always be copyrighted. The challenge associated with that right is that if we have 3 people that know how to code and we give them a method that we want performed in software code, it's highly likely that each of the 3 of them will code it in a different way. And as a result, they will be entitled to each entitled to a copyright on their thing. So the multiple parties can then perform the same task just using different code. So I would argue that code or copyright is not a great meaningful protection for code. I would actually rather manage it as proprietary information and not necessarily disclose the source code. And make that available to licensees as if and when they choose. We do grant lots of open source licensing, but if and when we have a meaningful commercial interest, I would rather manage those rights contractually rather than via a reliance on copyright. The next layer, though, is in addition, a method is patentable subject matter. Okay, and so you can file for patents on the underlying methods of software. You'll hear the term software patents. I don't love that because it's really a method patent. The reason that they're being rejected under 101 is that the method must result in an outcome beyond mathematics, right? So for example, when Boris Kovachev was designing algorithms to inform insulin delivery based on continuous blood glucose monitoring data, he took input in, did mathematical manipulation, and then output different information. If the method is simply data in, manipulation, data out, it's highly likely that you're going to get a rejection on a patent filing as 101 as just doing math. If, however, the method outputs a specific instruction like attenuate insulin delivery in response to this math, then you start to wade into the waters of much more likely patentable subject matter. So it gets a little bit into the nuance of how the method is described when you claim it in your patent application, but it must output, it must be, and the language is, it must be the method to deliver something more than simply the manipulation itself. Does that help at all?
It helps a great deal. Thank you very much.
Great. What else? Anything? All right. Well, I am available. So if, as you're going through your test prep, you have questions, don't hesitate to send me an email with the question and the answers in it, or the multiple choice in it, and I will respond as quickly as I can with that answer. And hopefully it won't be that it was a bad question that they asked, because I do find that sometimes these questions could be argued for multiple answers, but I'll do my best on that. I'm available at straightif@virginia.edu. That's my last name, at virginia.edu. And also what I will commit to is, as you send me these questions, I'll likely continue using them in this deck for subsequent years. So it will be for the greater good if you ask a question that you don't know, because it's highly likely that other people won't know it as well.
Great. Well, thank you, Michael.
Absolutely. Thank you. Good luck to everybody, and let me know if there's anything I can do to help.
Great. Sounds great. Everyone, I hope you have a great day. We'll get this information out to you, and we'll see you next week for session 8. Have a good day.
Bye.
Thank you.
Bye.
Bye-bye.